Hey, it's Coach Mark, and I want to bring you some tips about how to reduce some painful joint inflammation, commonly known as bursitis. So, a bursa is just a small fluid-filled sac around one of your joints. Maybe it's your shoulder, maybe it's your hip, maybe it's your knee. And what happens is that sac gets inflamed. And that can be caused by restricted mobility and overuse at that particular joint. And so some tips that I want to give you to try to relieve that pain in whatever joint it might be, shoulder, hip, knee, is a couple things. One, try to improve your mobility. Two, try to improve your strength. And then three, we can follow that up with some flexibility. So let's just say it's your hip, right, that is inflamed and in pain. Well, some gentle mobilization techniques that you can use. Let's just say you're sitting in a chair. If you want to improve the rotation of your hip, you can take one foot up off the ground and try to bring it across your body as if you were going to cross your leg, but you don't actually have to do that. So just bring your foot up, turn it in as far as you can until you feel some restriction, pause for a second, bring it back down, lower it down, and repeat. And you could do that, say 10 repetitions, and then we're going to bring it up and try to turn that hip out. Now this will be a little bit more restricted in most people. You're going to bring it back down, right? Try not to tilt or lean. You just want to get some natural motion of that hip. So again, we can turn it in across your body, you can turn it out away from your body, you can do 10 repetitions on both sides. Another one you can do is from a standing position. If you need to hold on to anything for support, make sure you go ahead and use it. We could try to bring a knee up towards your chest and then turn that leg out without turning your entire body. So we're going to lift up and turn out, and you should feel some movement mobility in that hip. Again, you're not trying to force it through any degree of pain, but we're just trying to increase some mobility. So 10 up and out on the left side and the right side. So after some mobility drills, what we can do is some strengthening. We prefer that you try to do some isometric strengthening, especially if you're in a painful range of motion. So again, what we can do is instead of bringing that knee up and that foot across your body, you would resist that motion. So that could be with your other leg, or it could be with the leg of a chair, something that's going to block that. You could even put a ball between your feet. But if you come up and you try to push into your opposite leg, give it a 5 count so you feel the muscles contract in that hip, and then return to the start. And again, we want to try to do about 10 repetitions. And we do the same thing turning out. So let's just say this was a heavy object. It isn't going to move, or it's the leg of a chair or a wall. We're going to lift up and just try to turn that leg out again so you feel the muscles contract on the side of your hip. Hold it for a 5 count, release, let it down, and repeat 10 times. And you can do that on both sides. So that's some strengthening that we can do. And then from a stretching standpoint, if we want to stretch out the hip, two primary areas. IT band, which is very common with some bursitis in the hip. We could do a standing IT band stretch. So let's say it's this side that needs to be stretched. We're going to cross the left foot over the right. If you need to hold on to something, that's fine. We could try to reach to the side so that you should feel a stretch coming up the side of that leg. One deep breath in and out. You could give it a 5 count, relax, return to the start, and repeat that 5 to 10 times. You can also lie down on the ground, and you can cross that leg over onto the opposite knee, and we're going to get more the back of the hip and back side, piriformis stretch. So grab behind that knee, or if you need to put a towel between there, you can. Let your head back, pull that knee towards your chest so you feel that stretch. Again, give it a deep breath in and out, and let it down. And again, you can repeat that 5 to 10 times. So we've got some mobility, some strength, and some flexibility to work on that affected area. Again, same can go for any other joint bursitis that might be inflamed. So if you need help, take those tips, try to do it on your own, but if we can help you further, certainly our IsoStrong program can increase your strength and stability that you're looking for, and our Smart Stretch Therapy can help stretch things out and mobilize those joints in a more effective way than you might be able to do on your own. So reach out and let us know how we can help. Otherwise, see you again soon.